for having me. I feel so honored. I really do. If I may ask you as we begin, if you have a cell phone, if you can turn it off or on mute. A couple of times ago when I spoke, I was just at this very special point and somebody's cell phone went off. And last time I spoke, my cell phone went off. So if you wouldn't mind, make sure to read your cell phone. I remember the first time I ever got slapped in the face. She was a cute little thing. Her name was Marty Harrison. Now, we were in kindergarten, okay? I was known as the kissing bee. I still am. It's absolutely benign. But that's just how I showed my affection. And I remember it as if it were yesterday. She was leaning up against her desk. And I leaned over and planted a big one on her cheek. And she hauled off and slapped me into the next week. And I remember the shock. I remember the pain. It hurt my feelings. It hurt my ego. And it hurt the heck out of my face. That wouldn't be the last time I'd get slapped in the face. But all of the rest of the slaps in my face, I felt good. And I hope by the end of our time together this morning, you'll come to appreciate what it is I'm referring to. What are we doing here? I'm sure at some point you've contemplated, what's my purpose? Is my purpose to become successful, amassing a fortune? Is my purpose to craft a legacy, a reputation that I leave behind? Is my purpose something as simple as we're just here to have a good time? Or is our purpose, perhaps, to touch the lives of others? I think it might be a little bit of each of those. It may be none of those. Because I believe our purpose is for the progression of our spiritual development. Transformational enlightenment. I think that's what this thing called life is about. Transformational enlightenment is when you develop and hone your consciousness in such a way that it results in a shift in the way you think. And as a result of that, it changes what you think, what you say, what you do. And ultimately, it changes what it is you are to become. Now notice I didn't say who it is you are to become, but what it is you are to become. Transformational enlightenment for me likely began decades ago. I just didn't realize it. I was too busy. I was an invasive cardiologist. My average day in the hospital, and I'm not exaggerating, was about 14 or 15 hours. I'd be in the hospital by 6 o'clock in the morning. I'd be in the cath lab by 6:45 to perform the first of maybe 6 or 7 heart catheterizations. Put in a couple of pacemakers, do some electrophysiological studies. I would see 40 people in the hospital with the help of the PA, by the way. I would see 40 people in the hospital and be over in the office by 1:30 to see another 20 or 30. It was a grueling pace. One that I enjoyed and I actually thrived on it. And I found the busier that I was, the more efficient I became, up to a point. And I had reached that point of diminishing returns. And what I would do when I would be making rounds, I would literally run from room to room in the trail of residents and medical schools trying to keep up with it. I would quickly peruse the chart, pull from it what I needed. And then I would take this deep breath and with this facade of calmness, I would walk into the patient's room. And I walked into this guy's room. His name was Art Blair. Now, Art had an irregular heart rhythm called atrial fibrillation. Not necessarily life-threatening, but bothersome. And Art had never met me before, nor had I ever met him. And as I walked into Art's room, the first thing out of this guy's mouth would go, "Whoa, Dr. Gordon, you're killing yourself." I said, "I beg your pardon." He said, I see all this marvelous energy surrounding you, but it's all fractural. And you better do something about it or something very bad is going to happen. And I said, "Mr. Blair, I'm the doctor. I'm here to take care of you, not the other way around." And he said, "Well, all I'm telling you is what I see, and you really need to do something about it." Well, I addressed his atrial fibrillation, told him how we were going to approach it, and turned on my heels and was on my way out of the room, already thinking about the next patient I was to see. When Art beckoned out to me, he said, "You know, when the student's ready, the teacher will appear. And I remember thinking, what's this old teacher talking about? And I left the room really without acknowledging that statement. Art ultimately went home, and a couple of months later came back in again with atrial fibrillation, and he said the same thing to me. He said, "You hadn't done anything about it yet, have you?" And I said, Art, I don't have time. I am so busy. I don't have time to take care of myself. I'm like this mouse on a wheel. I just have to keep going faster and faster and faster to keep things on. And he made a couple of suggestions. First of all, he suggested that to calm my mind, which is always going a million miles an hour, that I think about learning how to meditate. And I had contemplated that back in the 60s, but I didn't need that sort of thing. I'm in control. The other thing he suggested was that I read a couple of books by Dr. Wayne Dyer. Anybody here familiar with Wayne Dyer? Well, Art went home ultimately. About 3 months after that, he came back in, although this time something a little different. He was having chest discomfort. And it was so obvious that he had a blocked artery that I took him straight to the cath lab, had him on the table, about to begin the heart catheterization, when an emergency arose in the coronary artery. There was a guy having a major heart attack, an anterior wall infection. So we had to triage Art off the table to take care of this other fellow. And we left Art on the gurney out in the hallway. That other procedure took me about 2 hours to open up this widowmaker that the guy had. And about halfway through that 2-hour procedure, I stuck my head out into the hallway just to make sure Art was okay. He was asleep, or so I thought. Well, when it finally came time for Art to come back and put him back on the table, I apologized for the delay. And he said, "You don't need to apologize to me." He said, "I had 2 hours of great meditation. Do you want to know what you're going to find?" Now, here's a guy who's never had a heart catheterization. He's never seen a heart catheterization. I've done maybe 10,000 of these things. I have a good idea what I'm going to find, but I don't know what I'm going to find. But he's going to tell me what I'm going to find. I said, "Well, okay, what am I going to find?" He said, "You're going to find I have 2 blockages." So I said, "Okay, let's see how good they are." So we started the heart catheterization, and we inject dye into the arteries, and there's a camera that flows across the chest in several different positions to get more or less a 3-dimensional view of the arteries which are filled with dye. And I had just completed the procedure, and I must have cracked a little bit of a smile, because he asked me what was so funny. And I said, "Well, Mr. Hotshot Medicated Man, maybe we should have delayed you 3 hours rather than just 2 so that you really could have seen what you had. You've only got 1 blockage." I said it fairly cavalierly. Art looked at me with sudden conviction. His eyes pierced me when he said, "Terry, you're missing something." And I said, "Art, I'm not." And I showed him the picture, and he was so insistent. He said, "Terry, there are 2 blockages." And I remember the nurse kind of poking me in the rib with her elbow, looking like, what is this guy talking about? Because it was strange. And really, getting out of my hair, I took this view that I hardly ever took. And guess what I found? I found the second blockage. How did he live it? What was I missing? I fixed those 2 arteries. I can honestly tell you, I don't remember doing it. My mind was elsewhere. I couldn't wait to get out of the cath lab, to get over to my office, to see those 25 patients, so that I could get back over to Art Blair's room. I walked into his room around 7:30 that night. I said, "Okay, you got it. What is this about?" Art had these gorgeous hazel eyes, and they just lit up. He was like Mount Vesuvius. He just started spewing his spiritual journey and where it had taken him and how he had gotten to the point where he was. And what Art showed me was that I was missing something. Not only was I missing something, I was missing a lot of something. Art implored me to do something I'm going to ask each of you here today to do. And that is to be open to everything, attached to nothing. Now, that doesn't mean I want you to buy what I'm going to say today. That's not my purpose. What I want you to do is to at least think about it. Just consider that what I'm saying may be possibly true. was about a month after all this happened, and it had been a very stressful 3 months for me, that my wife and I and our children were about to take a much needed vacation to a place what we call Lake Mohawk, about an hour south of Akron. And you know what the last day was like. It's terrible. Everybody wants a piece of it. You know, I got home at 8:30, 9 o'clock. My mind was still going a million miles an hour trying to remember what it is that I may have forgotten. Piled the family in Suburban and off to Lake Mohawk we go. Now, on the way down to Lake Mohawk, again, my mind was just this flurry of thought. My wife, Angela, trying to make small talk, said, you know, honey, we really need to get back. The last thing I wanted to think about at that one time was a vacuum cleaner. I kind of told her so, and it wasn't in the nicest of terms. You remember something like this. You know, honey, you've been talking about this vacuum cleaner for just get whatever you want. I don't care what you say. Needless to say, the rest of the trip was very quiet. And when we got to the cabin, I knew just what I should do. I went straight to my room. The next morning, and I arise hours before anyone else in my family, what I do to unwind is I go down the hill to the lake. I get down on my knees and I pull weeds. It's to me such a grounding experience. It's a thankless job, but it gets me back to source, back to God. And I actually got down there before sunlight. So I'm pulling weeds and these ducks are floating past me. Look at this fool pulling weeds in the duck. And I'd been down there for a couple hours when my wife Angela left to go to the grocery. Now, I knew I was still in the doghouse because generally she'd yell down, I love you, sweetie. She didn't do it that way. So I knew I was still in trouble. Lake Mohawk is a big oval lake. It's about 10 miles in circumference. Front gate is around 6 o'clock. Our place is around 9 o'clock. It's about a 5-minute drive. And she'd been gone about 5 minutes when I heard her call my name. Now, the strange thing was I heard her call my name from behind me. And I even stood up, because behind me was just forest, trees, no houses, no cabins. And I even looked back up at the cabin thinking, you know, maybe she came back to tell me she loved me. And her voice was reflecting off the trees, but she wasn't there. And I paused for a good minute or two. And then got back down on my knees and started pulling weeds again. It was shortly thereafter that my daughter Layla came running out of the cabin, yelling and screaming, Daddy, come quick, come quick. So I went running up to the top of the door. She said, Mommy's at the front gate. There's a man dying and we need you. So I hopped in the other car, made the 5-minute trip in about 2.5 minutes. And as I pulled up at the scene of 4 people, there was one of them in a full cardiac arrest and 3 other people frantically trying to resuscitate him. We were in Carroll County, which at the time was one of the few counties in the state of Ohio that did not have 911 service. So I actually got there before the paramedics arrived. And my first thought as I got out of my car is I wish I had an automated external defibrillator. I do now, but I didn't then. So as I ran up to the crowd, I felt like Moses. I said, I'm a cardiologist. Can I help her with that? The water's part, and it's not baby. This guy was in full cardiac arrest. No pulse, wasn't breathing. Started doing CPR on him, and about this time the ambulance arrived. And they did not have a lot of equipment. What they did have is what I needed, a defibrillator. And they ended up shocking the guy about 4 times. Finally did get a heart rhythm back. He was not breathing on his own, so we had to intubate him, put the tube down into the airway. And I offered to ride with the paramedics up to the nearest facility, which was Canada. The gentleman survived. He did not awaken. He was breathing on his own with the assistance of oxygen. And I started to approach the man's wife who was now in the emergency room. And things were so hectic that I just decided to send a silent prayer her way. Turned around and got back in the ambulance to go back to Lake Mohawk. Now, it was on the trip back to Lake Mohawk that it hit me. I heard my wife call my name. Now, I'm a scientist. You prove it to me, and then I'm going to believe it. My wife, on the other hand, is a very, very spiritual individual. She's always believed in this sort of thing. So I wasn't about to tell her what I had experienced. Rather, I asked her what she had experienced. And she said, well, she pulled up. She saw there was a cardiac arrest. Her first thought was to turn around and go get me. But she knew that for every minute that someone remains in a cardiac arrest, his or her chance of survival drops by 10% every 60 seconds. So the 5-minute trip to go get me, the 5-minute trip to bring me back to the guy who'd been dead. Her second thought was, Terry, you're under so much stress and this is your vacation. Leave well enough alone, someone else can handle it. Said she couldn't do that either. So I asked what happened next. And she said, we're down here so infrequently. I decided to call, but I forgot the number. And I asked what happened next. And she said, I just called her name. Now, as God is my witness, 3 miles as the crow flies away, in the Suburban, with the air conditioning on, the windows up, I heard my wife call my name. Paul Harvey, age 2. That night, the phone rings. And it's the wife of the man that helped resuscitate. And she was so thankful. She said, Dr. Gordon, you came up and said, I'm a cardiologist. She said, I just knew an angel had arrived. At one point, I referred her to my mother because I've never been called my mother before. But she said, we're just so thankful that you happened to be at the right place at the right time, and that you were able to help save our loved one's life, and we want to get you something. I said, man, you don't understand. Being able to help save a life is the most invigorating thing you can do. And I don't want anything. She said, no, we absolutely insist. She said, no, we're working people. We work for Hoover to buy you a vacuum cleaner. I swear to God. Now, if something like that happened to you, doesn't stop to make you think. I don't think anything will. But what happened to me that day was a shift in my consciousness. I went in a nanosecond from saying, I'll believe it when I see it, to I'll see it when I believe it. It's totally different. Totally different. One of the things that I did is I started reading a little bit of Wayne Dyer. And had the opportunity to fortuitously bump into him on the beach of Maui, my hero. Things like that and stories that I've told up to this point started happening to me. I don't know why, but I became aware of it. I became cognizant of it. Little did I know that people like Wayne Dyer had entered my life for a purpose. It was June 29th, 2009. And my daughter, Maddie Rose, had come in from Chicago. She was teaching in school there. And she came into my office. And it's a parent's sixth sense when you just kind of tell something's not quite right. She carried this sadness with her. I said, honey, what's happened? She came around my desk and plopped herself down at my feet, put her arms up on my knees. And she said, Dad, and she's 27, calls me Dad. She said, Dad, I always thought that the older I became, the more control I assumed over my life, the easier life would become. And then with this heavy sigh and a single tear trickling down her cheek, she said, it's just not working out that way. And I pulled her up in my arms and I rocked her as I had for 27 years. And I thought for a very long time because I knew what I was about to say to her would be very important. I said, sweetie, I think that's how it's supposed to be. If we are to grow, if we are to progress spiritually, if we are to raise our consciousness, we must face greater and greater obstacles. Because it's only by overcoming those hardships that we get propelled onto that higher level. And I shared with her that everything is in perfect order. There's a saying from the Kabbalah, which is the ancient mystical text of Judaism. And in it says, it's the falls of our life that provide us the energy to propel us to a higher place. The falls of our life. And I left Maddie with one thought as I kissed her forehead. And I said, sweetheart, we should actually be grateful for the crap that comes out of it. 6:40 the following morning, I received one of the worst phone calls of the day. The great voice on the other end of the line informed informed us that our son Tyler, who was a student in Fort Lewis College in Durango, Colorado, had been involved in a single car accident. He flipped his car up over and over again. And he had shattered his neck. And then came the dreaded news. Your son is quite sick. You can't imagine. You can't imagine. You know, as parents, we worry about those sorts of things. We fret when our kids don't come home when they're supposed to, or they return home in a condition we're not particularly proud of. But when you hear the words, you can't imagine. I had about 20 seconds of denial. And then the doctor really kicked in. I knew exactly where we were headed. They were getting ready to lifeline Tyler from Durango to Denver, Colorado, where he would undergo emergency surgery. Within an hour, I hastily packed a bag and bolted from the house, speeding up to the Cleveland airport, trying to get on an overbooked flight to Denver in time that I could see Tyler before he went into surgery. Somehow I got on that overbooked flight, despite the fact that I was eighth in line. I was now seated next to a window on this airplane, incommunicado for 3 hours. It was the worst time of my life. I didn't know if Tyler was alive, dead, brain damage, bleeding out. It was just so frightening. And I felt like I was in this tornado. And it was loud, and it was whooshing, and it was dark, and it was dank, and I looked down the funnel of this tornado, and it was pure blackness. It was the scariest thing in my life. And I remember saying over and over again, I can't do this. I can't do this. I can't. And gradually, that loud whooshing sound began to abate. As I slowly became enveloped in this cocoon of white noise, strand by strand, it became this place of unfathomable peace. But I was still saying, I can't do this, I can't do this. And I don't remember if I actually heard the voice of God, but the words came from deep within me when God said, yes, you can. And I said, I don't know how to do this. I can't do this. And God said, Terry, just last night, you shared your truth with your daughter, man, yours. You can talk the talk, but now you're going to have to live it. And I said, but how can I do this? And God said, you just have to tell your daughter everything's in perfect order. This is in perfect order too. Even this horrific thing is in perfect order. And then the most profound thing was shared with me by God. When God said, treat this as if it was something you had chosen. Why would I do that? Why would I choose such a horrific injury for my son? What possible good could come from such a calamity? What hidden lessons could there be within a tragedy such as this? It would take me a while to get to that point. You know, there are some who believe that we actually choose what it is we're going to experience in a particular lifetime. And we make that choice before we come to life. Some feel that's destined by God. Some believe that it is in participation based on what our spiritual needs are. As I began to navigate this storm in our lives, the challenge for me, quite frankly, became adjusting my perception enough of the events to recognize the presence of God within them. And in order to do that, I had to take my mind way, way, way beyond what I had previously considered good and bad. I came to an understanding that adversity is a gift from God. It may not come enveloped in the most beautifully wrapped package. In fact, it may appear so disgustingly hideous that you can't imagine how it could ever be a benefit. I also learned that this reality in which we live is the perfect circumstance in which we can find what it is we seek, and that is insight. Look, crap happens. None of us is immune to the sadness and turmoil of this life. But life is balanced. It's coupled not only by those things that cause us grief and sorrow and pain. It's perfectly balanced by those things that provide us pleasure as well. And because of that, we are not overly burdened by the negative aspect of these experiences. The question becomes, is there such a thing as a negative experience? I don't think so. A tragedy is only a tragedy if I decide to make it so. The real tragedy lies in going through an experience such as this and not learning from it. Therein lies the tragedy. These so-called negative encounters can actually be a blessing in disguise. Fodder for growth, a catalyst for change. What we must learn to do is to free ourselves of the attachment to those things we consider and judge as good, as much as we should let go of the aversion to those things that we consider bad. We must maintain this balance, this equilibrium. You know, most of us think in terms of duality. There's hot, there's cold, there's good, there's bad, there's high, there's low. But the monsoon is countered by a calm, sunny day. Perfect health is balanced by disease and injury. In truth, they're not opposites, they're conjoined. They're in a continuum. About a week into our experience, and Tyler, our son, was very unstable. Almost died 2 or 3 times that week. And we were staying in an apartment juxtaposed to the hospital. And one morning I awoke, and there was a small crack in the curtains. And the sun was streaming in through this small crack, and it was projecting prisms, little prisms, multicolored prisms all over the ceilings and the walls. And when I opened my eyes, this was the first thing that I saw. And I remember thinking, thank you, God. This is such a beautiful day. Thank you. Thank you, God. And then suddenly, vroom, I was sucked back into the quiet room, and I realized where I was and what we were doing. And then I started to feel so guilty because I had actually enjoyed something. I enjoyed the beauty of this day when my son could only see darkness. And I enjoyed the prisms and the multicolored lights that my wife couldn't see those. And then it hit me. Why shouldn't I enjoy the beautiful day? It's there. It's like a little puppy dog sitting right next to me, just waiting to be noticed. Because you enjoy that beautiful day doesn't mean you don't love your son. It's all your choice on what it is you wish to place your focus. Let me demonstrate this. I'm going to ask you all to, I'm going to have this over for a second. I'm going to ask you all to put your 4 fingers very close to your face, about 5 inches, but up high, not down like this. I want you looking in my direction, but I want you to focus on those 4 fingers. Those 4 fingers represent pain and anguish and suffering and turmoil. Now focus on those 4 fingers, okay? Now don't move your hand, but instead focus on this flower, 3 or 4 fingers. And now focus back on your 4th finger. It's your choice, folks. You can place your focus on anything you want to. We have a choice when faced with adversity. That choice is we can resist the gift, and in doing so, suffer. We can spend our time licking our own wounds. We can victimize ourselves and suffer. Or we can choose to accept it and learn from it. One of the most important things that I learned through this experience is this. Living inside each of us are two selves. One self is planted in this material plane in which we live. It is a mortal self. It dies. It's fractured. It's fragmented. It's an ego encapsulated in skin, housed in this thing we call a body. It can be irreversibly altered by disease, by injury, and even by our thoughts. That's one self. The other self is the authentic self. It is the spiritual self. It is the immortal self. It is the self that resides in a place of much higher consciousness. It is immortal. Now, when I am in the physical plane, I can't tell you how painful it is to watch my son going through this ocean of suffering. But what I've been able to do is I've been able to become transparent. I've been able to rise above the material place, this place of higher consciousness. This is a place of unfathomable peace. It's a place where I have no agenda. I have no judgment. I have no interference. It's a place of passive observation. And what I can see from this perch is I can watch my son as he is going through this experience. I can see where it is he's heading. I can also watch my wife as she's going through this experience. And the strangest thing is I can, even from this perch, watch myself in the physical plane as I am going through this experience. I think what's going to happen one of these days, I'm going to be in this place of higher consciousness as I watch myself die. Because this place of higher consciousness is forever. Wayne Dyer relates in his book, Change Your Thoughts, Change Your Life. You can experience life while on the active side of infinity. As I went through this experience, Wayne Dyer suggested that I pen some of my observations. And I'll tell you, I've never kept a diary, I've never written before. But I started writing down these thoughts I was having about Tyler, about this injury, about life. And these observations morphed into my first book, which is entitled No Storm Lasts Forever. After we finish today, I'll be over in front of the bookstore signing copies if you're interested. It's a sweet book, and it's not just about a kid with a spinal cord injury. It's about dealing with loss. Whether it's loss of a relationship, loss of your job, loss of your spouse, loss of your portfolio, the fear, the anxiety, the stress that we all feel is the same. This life experience for me has actually made my humanness more complete. It also forever changed my doctriness. When I graduated from medical school, my wife, Angela, crafted this embroidered saying with the following words. I put these words on the inside of my office door so that every morning when I got ready to leave, I saw those words. And they go like this. Treat each of your patients as a loved one. Feel his pain, his loneliness, his fear. You will suspect everything and miss nothing. And like it or not, you will be loved as you love. I've been referred to as a wounded healer. Now, I have to tell you, when someone first made that suggestion, it made me feel very uncomfortable. But once I contemplated what that meant, it became very clear. In Greek mythology, Chiron was one of the wisest of the centaurs. While in battle, he was struck by an arrow that had been dipped in Hydra's blood, and he became very ill. The resultant lifelong anguish set him out on a journey trying to discover the cure for his own pain. Along the way, he learned how to heal others. And this wounded healer came to understand what his patients were experiencing. He could feel it because he was experiencing the same thing. When I first began the practice of cardiology back in the mid-80s, I felt that I shouldn't get emotionally involved with my patients. But over the years, I learned that although objectivizing a circumstance may make one a little more efficient, it also removes the humanity from the process. The healthcare provider is only effective when he or she is effective. It's through surviving personal pain and the turmoil of challenging sufferings that one can acquire great wisdom and healing skills. Can't find those skills in the book. These skills can only be learned from experiencing the pain yourself. And only then you can heal yourself and then truly relating to the pain of others, help them along their path of healing. For many years, I practiced within mainstream medicine, helping to cure my patients of various diseases. I've since learned that there is a huge difference between curing someone and participating in their healing. Curing involves utilizing the knowledge gained from science. This is how we've been taught to deliver evidence-based medicine. It's very important. The ever-changing technology of medicine and science is always intriguing me. It's exciting watching new innovations pop out of nowhere from expanding the mind. And when these new truths come into being, these new truths, the old truths kind of fall by the wayside. I finished my fellowship at the Cleveland Clinic, and it was during a very exciting time. Angioplasty had just been started. Stenting was in its infancy. Heart transplantation had just started. Implantable defibrillators were on the horizon. We graduated from programs like that thinking we could cure anything. Science is a truth that constantly evolves, and by its nature is forever changing. What I wasn't taught in my training program is that there is another truth. A truth that never changes. It's always consistent. It's always true. That constant in life is called spiritual truth. It has always been and forever will be. This truth in no way minimizes the contributions to wellness that science offers, but healing occurs in a place much different than what I previously considered. Healing occurs in that transcendent place of higher consciousness. The same place I described to you that I'm able to watch my son. It's in this place of the active side of the family, an immortal space, where a special milieu of energy exists. A place where complete healing occurs. I'll share with you, when our son was first injured, my prayer was not that he would walk again. My prayer was that he would find healing. My humble suggestion is don't wait for adversity to trigger you. Don't wait to begin a process of searching for enlightenment. The spiritual wisdom has always belonged to you. The same as it belongs to me, and the same as it belongs to everything in the universe. In closing, it's the falls of our life. The falls of our life that provide us this opportunity for growth. It provides us the milieu to transform, giving us the springboard to transcend to that place of higher consciousness. The place where true healing occurs. It's the falls of our life. Thank you very much.
Rain is falling down, white noise in the sound of echoes from days gone by. It seems I hear those sounds when there's nothing else to do. Maybe one try. And when I feel the need to be on my way home again, I close my eyes to see the light that is my one lost friend. The spring feels on my mind, thinking back to simpler times when I found me living day by day. The memories don't let go, though all the while we still struggle from where I am to where I used to know. And when I feel the need to be on my way home again, I close my eyes to see the light that is my long-lost friend. Rain is falling down, white noise in the sound of echoes from days gone by. It seems I hear those sounds when there's nothing else